Hi, good morning. My name is Sheri Burke. I'm with International Patient Facilitators, and I have the great fortune to be here today with our wonderful Dr. Sergio Verboonen from Obesity Goodbye Center. And we also have the good fortune to have here Mr. Robert Holt. First, I'll say hi to Dr. Verboonen. Hi, Dr. Verboonen.
Hi, Sheri. How you doing?
Great. Thank you very much for being here today with us. And Robert, thank you so much for being here.
Thank you for having me.
Robert comes all the way from Poto, Oklahoma, and Robert had a procedure done, how many years ago, how long ago was it?
2007.
Okay, Robert started this journey in 2007. First I'm going to talk a little bit to Dr. Verboonen about the procedure, and then Robert's going to give us a little bit of a story about how his progress has been since 2007. Dr. Verboonen, let's talk about Robert's procedure, the mini gastric bypass, which I believe is your favorite procedure.
Yes, it's my favorite procedure because the mini gastric bypass is work in two ways. The first way is restriction. The second way is malabsorption. It is easy by laparoscopic, and if the patient have a recovery time in about 5 days to work, to do almost everything. And we usually take that patient in our clinic for a couple days, and after that we do some testing before releasing, and patients are ready to go home to the United States or another place. We have patients worldwide.
So the mini gastric bypass, then, would you consider it a minimal invasive procedure because it's laparoscopic?
Absolutely.
Okay.
Yes.
Minimal invasive procedure takes approximately an hour in the operating room, an hour and a half?
About an hour and a half, yes.
And so it's like a double whammy against the obesity disease because you're doing a malabsorption procedure together with a restrictive procedure. Is that right?
Absolutely. They work in two ways.
Okay.
Restriction plus malabsorption.
Okay, so if you compare the mini gastric bypass to a procedure like the gastric sleeve, where the gastric sleeve only offers restriction, the mini gastric bypass will bypass the intestine?
Yes, the gastric sleeve is just restriction.
Okay.
The mini gastric bypass is a bypass. What do? We reduce the pouch of the stomach, we reduce the size of the stomach with staples, and then make a connection with the intestine, with the small intestine about 7 feet, 8 feet, 10 feet. It depends the size of the
patient.
The patient. Is a lower BMI, we're going to do lower malabsorption. Is there a big BMI, we're going to make a big malabsorption.
So that's interesting. So you as a surgeon have a little bit of control over this procedure about how many feet of intestine you're going to bypass.
Absolutely.
Fantastic. This is one of your favorite procedures, and it's because of the results that patients have?
Yes, because the patient don't need too much follow-up.
Right.
The patient don't need vitamins, don't need nothing extra. Don't need to come for pills, don't need to do nothing. Patients have a regular life, can eat everything. That's my favorite
So there's
procedure.
no restriction after surgery. Obviously, you have to follow your post-operative guidelines, mini gastric bypass for a month. But at that point, patients are able to live a normal life. They're able to eat normal food. They're able to drink normally.
Yes, normally the quality of life is very good. This patient can eat almost everything. They will learn to eat a little less fast. They will learn to eat slowly. But this is learning. It's be adapted.
It's learning as you go.